head-to-toe physical assessment. So first I'm going to wash my hands, and I need to check your bracelet. So if you can tell me your name and your birthday.
Katie George, March 3rd, 1993.
Okay. So we're going to start head to toe, and so first I'm just going to look at your head, make sure everything's in line and it's shaped normally, which it is. Next I'm going to look for infestations or lesions, which everything looks good, head feels normal, looks good there. Okay. Next we're going to look at your face and make sure that everything is in line and symmetrical on both sides, which it is. We're going to look, shine a light in your eyeballs, and check your pupils. And they are reactive, which is good. Okay, go ahead and look at my pen. Look at the wall behind me. Look at my pen again. Okay, good. And follow the tip of the pen with your eyes. Good. Okay, so your pupils are equal, round, and reactive to light, and they accommodate, which is good. Okay, next I'm going to check out your sinuses, and I'm just going to feel them, and if you feel any pain, just let me know. Your frontal sinuses and your maxillary sinuses feel okay to you? Okay. Next we're going to look in your ears, looking for drainage, abnormalities or lesions. Everything looks good on that side. Looks normal on that side. Okay, next, your nose, which is midline with your body. I'm going to look inside your nose. Go ahead and flare your nostrils for me. Good. We're going to look up inside. It's pink, warm, dry. Your mucous membranes are moist. Your septum is not deviated. Go ahead and take a sniff in on the other side. And everything is symmetrical bilaterally. Okay, next we'll look in your mouth. Open up big and wide. Say ah. Raise up your tongue. Good. Teeth and gums are normal. Your mouth is pink, warm, and dry. Your tongue is pink, warm, and dry. Your lips are pink, warm, and dry. Everything, or pink and moist. Everything looks good. Okay, so next I'm going to inspect your neck. So go ahead and raise your chin up for me. Your thyroid gland does not look inflamed. Your trachea is midline like it should be. Everything looks good. Okay, now I'm going to listen to your carotid artery. I'm listening for a brewery, which would, if there was one present, it would indicate an occlusion or plaque buildup. Sounds good bilaterally. Okay. Okay, so now we're going to take a look at your chest. Your skin is consistent with the rest of your body. I don't see any lesions. I'm going to feel for a temperature. It's pink, warm, and dry. Everything looks normal. Next, we're going to listen to your lungs. So take a deep breath. And again. And again. One more time. Okay, very good. Okay, while we're here, we're going to check out your cardiac, which is your heart. It's located in the 2nd through the 5th intercostal spaces. I don't see any visible pulsations of your heart. So I'm going to listen to the valves. So 2nd intercostal space to the right of the midline is your anterior, your aortic. Left of the midline, 2nd intercostal space is your pulmonary. 3rd intercostal space is your herbs. 4th intercostal space is your tricuspid valve. And 5th intercostal space at mid-clavicular is your mitral valve, which is also where your apical pulse is located. And while we're here, I'm just going to listen to your apical pulse. and it sounds normal. Okay, so next we will do your upper extremities. Nope, next we're going to do your posterior thorax. So I'm going to come around to the back. I'm going to inspect everything. Your skin is consistent with the rest of your body. And I'm going to just make sure that it's symmetrical. Go ahead and take a deep breath. Your chest rises and falls symmetrically, which is good. So we'll have a listen. Deep breath. And again. Again. Another deep breath. Another deep breath. And then on the right side, we'll listen to the lateral area so that we can hear that third lobe. And it sounds normal. Okay. So, now we're going to look at your upper extremities. But before we do that, we're going to take, do you do a breast exam normally each month? So what I need you to do, I'm going to teach you how to do a breast exam. So you'll raise your arm up above your head, and with your other hand, you will start in the axillary area, and you'll go in a circular motion down and around your breast. You should do this once a month. When you get to the nipple, you will squeeze. If there's any sort of discharge or anything, then you would need to call your doctor immediately. This is an exam that you should do once a month. It's easiest to remember to do it on the first day of the month, and so you should do that in the future. Okay, now we're going to look at your arms. Okay, so I want to make sure that your skin is consistent with the rest of your body, and upon inspection I can tell that it is. So I'm just gonna feel your skin and make sure that your temperature is normal, and that it's warm and your skin is dry. I don't want any moisture. I'm gonna check the turgor, less testy of your skin. Everything looks good there. We're gonna check your pulses. So we have your brachial pulses and your radial pulses, and they are symmetrical bilaterally, which is good. Let me see your hands. I'm just looking for clubbing in your fingernails, which there isn't any, and your cap refill is less than 3 seconds. So that's within normal limits. Next, we'll check your range of motion. So we'll do abduction, flexion, extension, and adduction. Great. Okay, now if you lay down for me, I'm going to check your abdomen. Okay, so visually, everything, your abdomen looks flat. There's no distension, and it's symmetrical on both sides. I'm going to listen to your abdomen in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. And I hear normal bowel sounds. They're not hyper or hypoactive, which is good. The next thing that we will do is I'm going to palpate. If I was suspect that you didn't have bowel sounds, then I would listen for 5 minutes to confirm that. So now I will palpate in your right lower, right upper, left lower. Everything feels symmetrical. I don't feel any lumps or abnormalities, so I think we're okay there. Next, we'll move on to your legs, which I will inspect your legs to make sure that your skin is the same color as the rest of your body, which it looks like it is. I'm going to feel for temperature differences. Your temperature feels normal in your legs. The skin turgor is present. Your joints feel normal. We'll do range of motion. So we'll do flexion, extension, abduction, and adduction, and we would do the same thing on the left side. We will check your pulses, posterior tibial and dorsalis pedis, and they are bilaterally symmetrical. Next, I'll have you pull your toes up towards your head, push down, Raise your legs up and push down, and everything looks good. Okay. We also need to check your cap refill, which is less than 3 seconds. Your nails on your toes look good. There's no clubbing or anything, which is all within normal limits. So that would be it. Thank you very much for letting me do this, and you have a good day.
Thank you, Miss Cora.